caution. Excuse me, coming through here. Can you move out of the way?
Where are we running?
Stay with me.
Hi, my name is Tina Ryan. I'm a physical therapist assistant student at Jefferson State Community College in Birmingham, Alabama. Today we're going to discuss necrotizing fasciitis. This is a life-threatening disease that can affect anyone at any age, of any race, or any nationality. It can be more common in those that have diabetes, that are intravenous joker users, have AIDS, malignancy, or are alcoholics. Necrotizing fasciitis can take a fun day of outside playing and turn into a day of tragedy. So let's listen to Amy Copeland's story.
First it was Amy Copeland. She cut her leg zip-lining and then plunged into this river. She was diagnosed with flesh-eating bacteria, which aggressively ravages the body's skin and tissue. Doctors had to amputate her leg. She is still fighting for her life. Caused by a strain of bacteria called Group A streptococcus. For many, the bacteria simply causes strep throat. In rare instances, pneumonia, the kind that killed Muppets creator Jim Henson. Experts say that the bacteria affects everyone differently, depending on their immune system.
On occasion, the Group A strep gets from the throat, circulates in the bloodstream, finds this area of muscle injury, and stops there, sets up shop, and begins to cause serious infection.
Amy Copeland fell victim to a perfect storm of circumstances, first suffering the open gash on her leg and then falling into the fetid river.
That water clearly was the cause, the source. There's no doubt about that.
Treatment consists of large doses of antibiotics and surgery. In about 1 in 5 cases, the disease is fatal. Amy Copeland is now showing signs of recovery. Today she was asking for books and smiling.
Proper diagnosis of necrotizing fasciitis is the key to prevent the loss of life and limb. If this soft tissue infection does not respond to antibiotics within 24 to 48 hours, other tests may be ordered. Plain radiographs may reveal gas trapped in soft tissue within the muscle compartment. If pressure are greater than 40 millimeters of mercury, it is called for immediate surgery. Biopsy of a frozen section is also another aid in diagnosis. Now we fall into the warning. The following images you're about to see are very graphic. Necrotizing fasciitis can start out as a very small scratch or blemish on your skin, but left untreated it can turn tragic. Any delay in treatment will allow this rapid spreading infection to enter into the fascia, muscle, or bone. This meets the preferred practice pattern of 7E. This refers to the impaired integrity associated with skin involvement exceeding into the fascia, muscle, bone, or scar formation. Other symptoms include warm, red, purplish skin, pain, soreness, blisters, or black spots. Pain is often described as way out of proportion for the size of the wound. Physical therapy interventions may be used throughout the treatment of necrotizing fasciitis. It may help to decrease inflammation. It may help to create tissue growth. It can be used in a lot of various ways, but it's also used after treatment. I have a case study from the Hindal Publishing Corporation that talks about a 27-year-old female that is 3 years post-operative from breast cancer. She's suffering from necrotizing fasciitis that also covered her trunk, lower extremities, and caused a lot of range of motion, and just general daily life got in the way of her being able to perform, take care of her children, and be able to move comfortably throughout life. They used diathermy. They used a pulse shortwave diathermy with parameters of 48 watts, 20 minutes per visit, and were used on the upper thigh, hips, and buttocks. And this showed a significant increase in joint range of motion. It got her able to, with the use of manual therapy and exercise, it got her to where she was able to go back to normal life, go back to taking care of her children, go back to being herself. So therapy not only plays the role of fitting you with the prosthetic, the orthotic range of motion, we also have to look at the interventions. With diathermy and any other modality, there's always precautions. Precautions include pacemakers in pregnancy. Precautions include being near electronics or magnetic equipment, obesity, or having copper bearings when this device is used.
A year later, her journey has brought her here, Touch Bionics, near Columbus, Ohio.
All right, so you ready?
Yeah.
For Amy Copeland, Life is about to change.
What do you think? Exciting.
Again.
Yeah. Sometimes I wake up and I'm just like, oh my God, this is my life. This is crazy.
This horrific flesh-eating bacteria can strike without warning. Early diagnosis and intervention can save a life or a limb. A full medical team is needed for full recovery. Medical doctors, surgeons, nurses, psychologists, physical therapists, and physical therapist assistants play a major role in returning life to normal. A normal life can resume after this life-altering infection invades the body. Attentive caregivers are also crucial. Amy Copeland was a happy ending to a nightmare. Her road to recovery was long and painful, but many did not get the chance to recover. Her early diagnosis and quick thinking team saved her life. Knowing the signs, being aware of the devastating disease, this allows a media to share a more happy story, a story that Amy Copeland shared with us. Go. Sound check. Morning vocal check. Morning vocal check. Sheldon Cooper. Necrotizing fasciitis can happen at any time. It can ruin a good day of... Not make a good newscaster. Okay. Are you deleting all these that I'm screwing up? Proper diagnosis of necrotizing fasciitis is the key to preventing loss of life. Strong and
Just like
medical terminology, I hate it.